Whitney Eads. Hello, Whitney Eads RN, off-grid grandma. Listening to the birds singing up above me in the trees. So check this out. I have this interesting bill of lading, and I don't know if I can really get the info in there, but Shield Healthcare is the company, and I believe that this is a case of massive fraud. Sure, they say that they can charge whatever they want for administrative costs and the fees, but I went through this list that I have and priced everything from the source for Medicare billing and what the cost would be to the patient. It is a medically necessary supply, and I could find the supplies direct from the source for about $800 a month. Shield Healthcare bills this particular client over, what does it say on here? $1,515 for a shipment that is priced for $856. So I would like to know, how does it cost Shield almost double the cost for administrative costs to process this for this patient that needs these medically necessary supplies? Sorry, my tongue didn't want to work. And how is it okay that we allow this type of price gouging to go on? I also have another one that gets all of these incontinence supplies sent, and they don't use the incontinence supplies that are sent to them. But guess what happens? You can't send them back because once they're shipped out, they're an incontinence supply, so they're considered contaminated or of the patient. So there's all this billing that goes on for Medicare for people that don't even use the supplies, and you can't do anything with them and you can't return them. So there's another one. I think that this company, Shield, is doing a poor job of having due diligence and looking at what is going on with their orders and evaluating. This one in particular has multiple years-long errors that have tried to be rectified and they didn't happen. So how do we let this stuff go on and on and on and on and on? How does this happen over and over again to people? And how are we allowing this Medicare billing to continue to happen when people aren't using or don't need the supplies, and Shield won't let you shut them off? Yeah, I think that somebody needs to look into Shield and figure out what's going on there, because no matter how much I've tried to rectify it at the level of the ordering, haven't been able to get anything to stop. So maybe somebody else has a way to whistleblow against Shield and their billing to Medicare, figure out about price gouging, figure out about monopolizing incontinent and healthcare supplies in the home and people not being able to receive them. All right, let's look at this. It's Medicare fraud. We got to do something about it. We deserve better. We really do. We shouldn't be paying for things that we don't use or need. Off-grid grandma, over and out.